Hi, Tim Reha here live in studio at the Digital Health Summit in San Diego 2013. Super excited to have Sharon Knight here, who's the founder of Avik Ventures.
Oh, great to be here, particularly here in sunny San Diego.
Yeah, it's nice out. So I flew down from Seattle. You're based in?
I'm based in San Francisco, but flew in from New York last night, so it's a treat.
So I want to hear about your background. I love to connect with women entrepreneurs because you're an inspiration for other women. And just in general, you have a fascinating background.
Great, thanks. So my background's probably a little bit unusual for the healthcare industry. I come from outside it, like more and more people are these days. Prior to joining healthcare, I was in gaming. I was with Electronic Arts for a number of years, which I'm seeing an interesting intersection between gaming and healthcare. Prior to that, I had a retail consumer background, so there's also some interesting influences at play there as well.
That's especially coming back from our last event, which was at the Digital Health Summit at the Consumer Electronics Show, and we saw lots of gaming. The Connect sensors are doing a lot of innovation things, especially mobile and whatnot. So inside the panel, there's a number of topics discussed. In healthcare, startups are different in a unique breed, I guess, in their own aspects. What happened inside? Or like, what were some interesting takeaways that you guys were discussing there?
Oh, so. I think a couple of things. We talked a lot about the funding environment and how challenging or not it is depending on the stage of your company, and how best to tap into angels, how to use incubators, when it's appropriate to use equity versus debt versus just convertible notes. So there are lots of options available for companies today, and it's all about they need to put themselves out there. It's about the power of the network. It's about the value of introductions and meaningful connections. And those, especially for the early stage company, those angel relationships and advisor relationships are really critical.
So what are some tips and tricks you would give from your experience in consumer and gaming that you can bring to the table in the digital health space?
Wow. I'd say, first of all, know your customer is one, and incorporate the voice of the customer into what you're building. Iterate. The customer will tell you what's working and what's not, and so data is really important, I think.
What excites you in this space?
Oh, lots of interesting things. I'm really bullish on health and wellness. Unfortunately, there isn't a lot of money yet in that space, often the question of who will pay. But I'm interested in how do we further that? How do we change the trend lines in this country, particularly around obesity and diabetes and Alzheimer's? And it's pretty frightening when you actually look at the numbers. So I'm excited about what innovation can happen. How do we leverage what's going on in the quantified self movement and self-monitoring? How do we marry that with EMR technology to provide real meaningful analytics to monitor and care for people?
Yeah, because we keep hearing about big data, and a lot of what happens, I guess, is predictive technologies down the road. What do you see happening in the future in this space?
Oh, wow, that's a big question. Obviously, the predictive analytics are key, particularly in large provider organizations, key to efficiency, key to cost reduction, key to improved outcomes. I could envision a world, and it's sort of fun sometimes to do a little bit of scenario brainstorming in the future, a world where there is much more reliance on self-monitoring and people having health plans that actually mean health and wellness plans, and they use technology to monitor whether they're healthy or not and whether they're staying within parameters that they define with their health coach, for example, and that the medical establishment is only intervening when necessary. So I think there is a movement that's going to gain even more momentum of pushing more responsibility for care onto patients and pushing it onto them before they become patients.
So you've been working as an angel investor, and now you're working to get back into what?
So I've spent the last year immersing myself in health innovation, particularly focused on healthcare delivery and health IT solutions. Prior to that, I was president of a company called One Medical Group, which is a technology-enabled boutique primary care model that's operating San Francisco, New York, Washington, Boston, and Chicago, and really turning the primary care model on its head. I'm interested in getting back into an operating role. It's been fun and enlightening to have my hand in 20 different pots, but I think more soul-satisfying to actually be building something and delivering something that can be a real change catalyst.
So what would be the best way for somebody to reach you then if they're interested in approaching you?
Sharon at avikventures.com.
And what's next for you?
Headed to Seattle tomorrow in the near
Oh,
term.
what's going on in Seattle?
Talking to a company up there that's doing some interesting things with dual eligible populations in terms of how to reinvigorate the care model for that underserved population.
Great, great. Well, hey, thanks so much for your time and being on the show and being part of the Digital Health Summit family.
Great. Thank you very much.